supportive throughout this entire thing. So I'm going to talk a little bit today about sarcoidosis that involves the nervous system, or neurosarcoidosis. And first off, it is a more rare manifestation of the disease. Somewhere between 5 to 15% of people with sarcoidosis have involvement of the nervous system by our best estimates. And approximately half of those actually present with their neurologic symptoms. So it's not always recognized that they have other organ systems involved at the time they come in. Eventually, however, 80 to 90% of people with sarcoidosis do have involvement of other organ systems, like the lungs and skin. So I'll start with a little bit of an overview of the nervous system, just to give you a tour here. So we really divide the nervous system into two main parts. So one would be the central nervous system, which is the brain and the spine, and the other is the peripheral nervous system, which is basically everything outside of that. And for the peripheral nervous system, we have nerves coming off of the brain, or the cranial nerves, and then nerves coming off of the spine, or the spinal nerves. And there are other parts of the peripheral nervous system that control certain bodily functions, like breathing rate, or heart rate, or the pupil's response to light. And those can all be affected by sarcoidosis. So again, another common theme that we've seen today, any part of the nervous system can be affected by sarcoidosis, and the symptoms that people present with can be very different from one to the next, as can the severity of the symptoms that they present with. So some of these symptoms can be very specific, like loss of vision, facial droop, difficulty with walking. And some of these symptoms can be more hard to describe, like problems with memory or concentration. Sometimes people have fatigue. Sometimes people have pain. Sarcoidosis can also mimic other diseases that affect the nervous system, like multiple sclerosis. So sometimes it can be hard to distinguish between sarcoidosis and these other conditions, especially when people first present. And like I mentioned before, everybody is different, both in terms of the symptoms that they present with and the severity of those symptoms. So one of the common manifestations that we see in people who have nervous system involvement is involvement of the cranial nerves, or those nerves coming off of the brain. And of the cranial nerves that are involved, the facial nerve is often involved. Somewhere between 25 to 50% of people who have neurosarcoidosis. It can present with difficulty closing the eye or sagging of the face. Sometimes there's an asymmetry in the smile when people smile, and it can affect one or both sides of the face. But fortunately for this particular presentation, people tend to recover very well. The other common manifestation that involves the cranial nerves is involvement of the optic nerve, or the nerve that conducts signals from the eye to the brain. And here you see a picture that just shows the back of the eye and some swelling where that nerve is inflamed. That happens somewhere above 20% of people who have neurologic complications from sarcoidosis. And sometimes people don't recover as well, even after we get them started on treatment. Other cranial nerves can be involved too, so people can have problems with hearing, they can have problems with vertigo, they can have problems with difficulty swallowing, they can have problems with smell. So almost anything that you can think of can be involved with sarcoidosis. The other common system that's involved is the central nervous system. Usually when the brain is involved, it affects the covering of the brain. So here is an MRI where people were given some contrast dye to sort of highlight those areas of inflammation. And what you can see is the covering of the brain here lights up. And so that shows you that you've got some ongoing inflammation here. And it tends to affect the base of the brain. So you see that those are the areas that light up the most on this particular scheme. Symptoms usually develop over weeks to months, and they often include things like headache, There may be a positional component to the headache where it's more severe when someone is lying down. There can be problems like sensitivity to light or vomiting, and people often have pain and stiffness within the neck. Sometimes that can progress further, and people can get involvement of the pituitary gland, which is important for secreting hormones. So you can be deficient in certain hormones, which can lead to other complications. Another more serious complication of meningitis can be lack of absorption of the fluid in the brain. And so you can get a buildup of pressure that can be very damaging if it's not controlled for. What can happen if the meningitis is allowed to go long enough is it can start to invade the tissue in the brain. And it usually travels along the blood vessels to the deeper brain tissue. Symptoms, again, are going to be very variable, and they're going to depend upon the areas of the brain that are affected. In addition, sometimes you can get an area that's irritated that can lead to seizures. So seizures can be another manifestation of sarcoidosis that people don't always think of when they come in to get evaluated. And then lastly, the central nervous system can also affect the spine. So here, like in the brain, you see that there is typically some inflammation around the covering of the spinal cord that then invades inwards. And so that's a pretty characteristic pattern that we see on imaging with the MRI. People who have spinal cord involvement can have difficulty with weakness in the arms or legs, loss of sensation, and problems with balance. And sometimes, especially if untreated, it can be very severe. But in all of these cases, the first thing that we do to confirm that this is a pattern that looks like neurosarcoidosis is get an MRI, both with and without contrast. Like I mentioned before, the peripheral nervous system can also be involved. And these symptoms tend to include things like numbness, tingling, weakness, and sometimes problems with walking. So this is just showing one of the diagnostic tests that we use for peripheral nervous system involvement. It's something that's called a nerve conduction study. And so they're placing a little electrode right there along the tracks of one of the nerves. And what they're doing is shocking the nerve and seeing how well it conducts electricity lower down. This can tell us how well the nerves are working, and it can give us a sense of the pattern of involvement of the nerves, which is actually very important because a lot of problems can affect the peripheral nerves, and they're not all sarcoidosis related. So we have to make sure that what we're seeing is actually related to sarcoidosis, and we're treating the right thing. And usually for this, the nerve conduction studies are the first step, followed by something called electromyography, where they take a needle and just insert it in the muscles to see what the electrical activity looks like at rest and with activity. So a lot of problems that affect the large nerve fibers tend to cause problems that are relatively symmetric between the two sides of the body. So if you have numbness on the left side, it's almost a mirror image on the right. When sarcoidosis affects the large fibers, the large nerve fibers, it tends to not cause that kind of a pattern because it picks off individual nerves at sites where there are inflammation or where it infiltrates into the nerve tissue. So the pattern can also be helpful to distinguish between sarcoidosis and other problems. And in addition to the large nerve fibers, sometimes we see small nerve fiber damage in people who have neurologic complications from sarcoidosis. This usually manifests as unexplained burning pain or tingling. People can have reduced sensitivity to temperature sensation. They can have problems with sweating. They can have lightheadedness. And they can also have GI disturbances. And this pattern is a little bit different too. So in this one, it's usually something called the stocking glove pattern. So you can imagine sort of the areas covered by stockings and the areas covered by gloves. Those are the most commonly affected. And people usually have a burning pain, a very painful component to the nerve damage that they have in these areas. This is most commonly diagnosed by a skin biopsy, where we take a little sample of the skin and we look at it under the microscope. So you can see here normal tissue, where we've got the dark nerve fibers that are showing up within the skin surface. And then in a patient with small fiber neuropathy, all of those nerve fibers are gone because of damage and injury. So once we see someone with suspected neurosarcoidosis, how do we know it's sarcoidosis? Well, there are various levels of confidence in the diagnosis that we have. So first, in all cases, we look for a classic presentation of sarcoidosis with nervous system involvement, and we make sure that we exclude things that can mimic sarcoidosis. A higher level of certainty happens when we can get a biopsy that shows the granulomas on pathology that are really defining the disease. And typically we look for things that are easy to biopsy, like the lungs, like the lymph nodes. The highest level of confidence comes from biopsy of nervous system tissue that shows evidence that someone has sarcoidosis. But as you can imagine, it's often hard to find a good target because there's very little within the brain or the spinal cord that you would feel comfortable biopsying unless you absolutely had to establish the diagnosis. And then treatment. So we've already talked about a lot of the treatments that we use to suppress the immune system. They're going to be very, very similar for nervous system complications of sarcoidosis. Steroids are the first-line treatment and the mainstay of treatment, but then we try and get people off of steroids as quickly as possible. We use steroid-sparing agents like methotrexate and azathioprine, both to reduce the dose and duration of steroids and also to get the disease under better control if it's not completely controlled with steroids alone. And then lastly, there are some other treatments that have been very promising for people who don't respond initially to steroids or to steroid-sparing agents, like the TNF alpha blockers, infliximab, and adalimumab. And those have been very effective for people as well. Depending upon the severity of the disease and what areas of the nervous system are involved, we might decide to go to some of those more effective but slightly riskier treatments from the very beginning. In addition to the immunosuppressive treatments, we do a lot for symptom management in people who have neurologic complications. So pain can be a large problem for these patients, and we have a lot of nerve pain medications that we can use to help get those symptoms under control. Bladder function can be a problem, and people can have problems with other symptoms as well, like tremor, that we can work with medications to get under control. Hormone replacement can be important for people who have involvement of the pituitary gland and are hormone deficient. And then on top of that, physical therapy and occupational therapy are really mainstays in the way that we treat people to make sure that we maintain the level of function that they have, improve as much as we can, and help people compensate for the injuries that aren't going to completely go away. But that being said, there is still a lot that we don't know about this disease, in part because of its rarity. We don't fully know how common neurosarcoidosis is. Our estimates are usually based on small case series of people that we've compiled from a lot of different centers. We don't know what predicts who will get neurosarcoidosis, which is important information to know. And then we don't know if there are better ways to diagnose neurosarcoidosis earlier. So right now, the diagnosis is really based largely, like we mentioned before, on biopsy, where you get a piece of tissue that shows sarcoidosis, and then establishment that you also have involvement of the nervous system. But even with that, there can be long delays in diagnosis after people initially present with their symptoms. And then we don't really know how best to track neurosarcoidosis in clinic. So that's one of the things that I'm interested in is better measures for the disease to make sure that it's responding appropriately to treatment and to make sure that we can follow it and see how people are doing over the long term. And then lastly, there's still a lot to be done to show which medications work best for people with neurosarcoidosis. And one of my hopes is that as we establish better measures of the disease, that will lead to more clinical trials that will give us more definitive evidence for how to treat this disease. So that's actually all I have.
Thank you so much, Dr. Moss. Last but not least, before we get